Hello, this is KatharineRoberts, RN, and this is my presentation on the concept application project in healthcare delivery. So the overview of the patient care delivery system. So in this slide here, I have this one flipped because I always like to mention the patient is the center of this system. And so then just kind of remembering that the patient often gets lost in the shuffle. And at my work, before I start talking about it, I will say that there's a saying that you're either caring for the patient or you're caring for the person who is taking care of the patient. That's going to be something we'll keep track of as we move along in my presentation. So going from macro system to micro system, the macro system is the American healthcare system, and that includes the Affordable Care Act, the Centers for Medicaid and Medicare Reimbursement, JCAHO, all of those regulatory agencies are part of that larger system. And then we work on down to Banner Health Systems in the next level of food chain, and that's a network of linked services, including outpatient clinics, medical hospitals, and a behavioral health hospital. And that's what I'm going to be talking about as my clinical microsystem, and we'll move further down to my specific unit. But we are fortunate at Banner Behavioral because we are within this larger system. Behavioral health hospitals are not typically revenue generating, and Banner Health is a not-for-profit institution. So I am going to discuss the clinical microsystem of the acute adult inpatient unit. And so from here on forward, my slides will list acute adult unit as my clinical microsystem for this presentation. And here's the front line of where care is dished out for the patient's own behavioral health diagnosis. So my definition of the clinical microsystem from Nelson is that clinical microsystems are the small functional frontline units that provide most healthcare to most people. They are the essential building blocks of larger organizations and of the health system. So discussing leadership. The role of leadership for the microsystem is to maintain constancy and purpose, establish clear goals and expectations, foster positive culture, and advocate for the microsystem in the larger organization. There may be several types of leaders within the microsystem, including the formal leaders, informal leaders, and on-the-spot leaders. And this is also from Nelson in 2002. So the formal leaders are the managers up to the directors and the CEO. And on my unit, there are both nighttime and daytime RN clinical managers. There's a senior RN manager, and then we lead up to the director of nursing. So then we have our informal leaders, and we have a few people that function as informal leaders on my unit, and one of them actually used to be a manager of your unit and went on to do a different job. But there's sort of a culture of everyone going to her with questions. She's sort of an informal leader. Another informal leader is our informatics trainer, and we don't see her very often. She comes about once a week, but when she's there, she gets a lot of questions and she provides a lot of information because we have changes to our computer system. And then surprisingly, another informal leader that I identified was the health unit coordinator. And he has phone numbers and faxes and information that the nurses are constantly needing, so he's a go-to person. Controlling the phone calls, timing of the new admits, and the spread of information makes him a highly valued leader on our unit. And then we have our on-the-spot leaders, and I would be an example of this person. So if a patient has a code, I get called in to direct the panicked. I also get frequently called to do EKGs and work the computerized interpretation program when no one else can do that. And these are on-the-spot situations that ask me to lead my teammates because of my past experience and knowledge. So on-the-spot leaders. Then we have the organizational culture and support. And given that the organization is the integration of multiple individuals and groups of individuals, that the process of organizational learning begins with individual learning is worth emphasizing. That's from Montuori in 2000. Culture and support on the acute adult unit. So there's a certain defining characteristic of a psych nurse, since this specialty requires a lot of patients. These are patients that appear in all specialties. We can have psych patients having babies, psych patients having heart attacks, but they come to us when their mental health diagnosis needs stabilization. So besides all being registered nurses with the organizational culture set forth by the Arizona State Board of Nurses, psych nurses all take CPI, which is the first defining certification that creates unity with our nonviolent crisis presentation. So that is one of the supports that's provided by the Banner system for our culture. And then organizational learning is provided by what we call the Banner Learning Center, and we can take classes to further our education. We can sign up through the computer, and then there are also outside colleges for which Banner provides tuition reimbursement. So the patient focus and the staff focus. By insisting that patients retain their dignity, influence, power, and unique identity, staff become collaborators in care, genuine partners who want patients to have control. That's from Taylor and Rutherford. So the way that we sort of demonstrate patient-centered care on our unit starts right with the staff. Banner uses a behavioral interviewing scenario where the staff has to actually say what they would do in specific situations. So it's a really good way to kind of see if a potential employee is going to be patient-centered. From there, with our patients, we use a system of teach-back for patient education. So, for example, during a discharge, the nurse may go through the importance of staying compliant with psych meds with the patient and go through the medications, uses, and times of the patients. And then the patient has to actually teach this concept back to the nurse, what the meds are for, when to take them. And that's a good way to effectively gauge and enhance the learning, and it creates a patient-centered teaching experience. And then we have our interdisciplinary care plans. And so right at an admission, we initiate a treatment plan for the patient, and right on the top of the care plan is what is the patient's self-statement of their both problem and goal. So it's with quotation marks, it's right from the patient. And then each department, social work, psychiatry, nursing, we all add to that plan and subtract. So each care plan is individualized. It's not a formulaic thing. Interdependence of the care team. So the interaction of staff is characterized by trust, collaboration, willingness to help each other, appreciation of complementary roles, and a recognition that all contribute individually to a shared purpose. This is from Nelson as well. Teamwork on the acute adult unit. So the frontline team of this particular microsystem is composed of registered nurses and behavioral health techs. And the team is situated in an open concept unit that's recently been remodeled, where the nurses station actually juts out into the unit, so we are visible and with the patients at all the times. So this sort of heightens our interaction with them. And case management is a very intricate part of our unit, and they are actually housed right behind the nurses station in an office, and we rely on them for outpatient services, like they coordinate all of that, and then they also rely heavily from the nurses for their assessment detail. And then there's the providers. So on our unit we have 2 psychiatrists and a psychiatric mental health nurse practitioner designated for us, and they work 7 days on and 7 days off, 24 hours a day. So they're also the ones that are on call for us if we need them off shift, and that's really handy because they already know the patient. And they also have their offices right on our unit, and they solicit a lot of feedback from the nurses. It's a partnership. We work together. So as far as use of information and healthcare technology, technology smooths the linkages between information and patient care by providing access to the rich information environment, from Nelson in 2002. As far as how we use healthcare IT on the acute adult unit, we have a computerized system of charting called Cerner. and that is where we maintain the electronic health record, or EHR. And this is the same system used at all the Banner facilities. So this makes it really nice if we need to send a patient out to a neighboring Banner medical hospital. Then we can see the reports through our system, like their labs or their x-rays, any kind of crisis evaluation, or provider or nursing notes. And likewise, we also can scan any kind of paper document that comes to us from any outside facility, and so it'll appear right in our Cerner system. And then we have a Pyxis system, like many facilities, to make sure that we give the right drugs and the right dosages. And then we can scan those medications, and they will appear in our Cerner, so that we can virtually eliminate medication errors if we do all these steps. And as far as faxing, and this is an important feature, although it's kind of becoming something that we forget about, but faxing coordination of care info is a core measure at Banner. We do it right before the patient is discharged so that their records are already at the outpatient provider, and that is there so when they leave they have a smooth transition. As far as the process for healthcare delivery improvement, a rapid learning health system supports the development of learning networks, delivery systems, and professional societies that use EHRs and computerized databases to assess their own performance, manage the adoption of best practices, learn from their results, and feedback these lessons for more advances in patient care, from Etheridge. And we are moving in the direction of adopting a learning health system on our unit. Some things that are already in place is we use Crames Online for patient education. It's a really good way to also teach aftercare procedures or to explain a diagnosis. Medline Plus is always an availability. There's a link right from my computer's home screen, which will link me to the National Institute of Health if I need to look something up for a patient. And then we also have a Sims lab through Banner. So if, especially like in psych nursing, if you start to lose some of your skills, if you haven't used them for a while, you can always go to this simulation lab and stay up to date on the latest ways of doing things in nursing. And so this is kind of important because with behavioral health patients, they often have multiple medical diagnoses on top of their behavioral health diagnosis, and they maybe have multiple medicines. So as we move toward a learning healthcare system, we can see how all these things work together through databases, and we can see medication interactions, and we can see the best practice for that individual patient. So in the future, this might even eliminate a patient receiving multiple opinions from different providers, because we'll be able to tailor-make their care. Staff performance patterns. So outcomes are routinely measured, data is fed back to the microsystem, and changes are made based on the data. This is from Nelson. So the way that we measure outcomes is the employees can provide feedback to other employees. We actually do this formally once a year through an anonymous system where our teammates will select specific people that they would like to provide feedback for them. And then our managers also provide feedback to us in the form of our yearly evaluation. And they'll show charts on our unit that show our medication scanning percentages, our patient satisfaction scores. These are all ways that we can see our outcomes. And employees at my work will also provide feedback to managers through a survey on them. So the specific aspect targeted for improvement, the experience of nursing staff and consumers in inpatient mental health wards is often reported as being negative. Efforts to improve culture and practice have had limited success with ineffective leadership, staff resistance, and unresponsive organizational culture identified as common barriers to change, from Beckett in 2013. So the area for improvement on the acute adult unit that I have chosen is sort of that culture. And although operating as a behavioral health hospital since 1980, there's been a lot of leadership changes that have occurred within the facility as they became bannerized. That's just happened within the last decade. So there's been a lot of expansion there and a lot of remodeling. And so a lot of working relationships have become kind of disjointed there. And I've been there less than a year, but this is sort of a cultural problem that is going on at this facility. And the physical layout of the campus is such that there's like a courtyard and a swimming pool in the center of it, but all of the units are linked just exteriorly, so you actually wouldn't interact with any other units unless you saw them at the cafeteria. You could come and go out your back door and never see anyone else that works in your facility. So another issue is compassion fatigue. Taking care of difficult, unpredictable patients can be very draining, and many times psychiatric patients do not recover despite the interventions that we provide. So there can't sometimes not a lot of rewards in psych nursing. And taking care of patients that are addicted to substances and can be med seeking from nurses is tiring if the nurse has to redirect the patient all the time. And having to strip the patient of their autonomy when they come in, they can't have their makeup, they can't have their electronic gadgets, not even their shoelaces, and this is all for their own safety. It doesn't start off a harmonious relationship right from the start with the nurse. So that's another aspect of the culture of this sort of negativity. And so due to all of these factors, this sort of prevails. And even though the folks that work there have very enormous hearts, sometimes it's misinterpreted. So leading the plan for healthcare delivery improvement. Taking better care of the staff will improve their positivity and their ability to take care of the patients. And the internal customer is also the exterior customer. So when we discuss staff retention and morale on the acute adult unit, there's a few things to take into consideration. So using a systems theory, it's easy to see that the well-being of the nurse is the frontline clinical microsystem is of utmost importance in healthcare delivery. So if you ask a patient how their hospital stay was, you will more than likely hear first how their nurse was. And psych nurses in particular work with patients that are both emotionally and mentally draining. And much of the general public does not even realize that they're sick due to this ongoing stigma. So first off, enforce that the staff take their breaks away from the patients. Staff on the acute adult unit have gotten into the habit of not taking breaks, even though they still clock out for them. So if one staff member does take a break, the other staff often seems hostile about covering their patients. This culture has to be changed, so the expectation needs to be that every nurse can leave the unit for breaks. Even if the nurse wants to forfeit, the rule must be present so the culture can be changed. And another idea is to create a relaxing de-stress room for staff to recharge after working with a difficult patient. At present, there is a staff break room, but it has linen, supplies, a treatment plan board, so it's not a welcoming environment for staff. De-stressing can actually kind of increase the stress. And case managers and providers have doors to their offices, but the nurses and BHTs are out in that open concept unit for the entirety of their shift, and they need to have a place where they can go just to take a few minutes to relax. And half the year in Arizona it's too hot to go outside, so the room needs to be created, or the current break room needs a makeover to make it a recharging space. And another idea to increase this morale is to bring back the staff suggestion box and a unit-specific newsletter to improve communication and the flow of new ideas. Presently, many of these frontline workers don't really feel that they have a voice to offer suggestions or feedback. The clinical leaders are often appear really busy, like they can't really be approached with ideas, even if they want to. So a simple suggestion box with a monthly recap of what the ideas were, and some visibility to those ideas would improve communication. It also provides a forum for frontline workers to share some of their stories, and to find out what worked or didn't work with a patient. And it helps build the team. It helps improve the morale, and it helps improve the healthcare delivery system. Thank you. And here, these last two slides are the 5 references I used for this presentation. Thank you very much.